Foods that may increase mortality risk for elderly people when consumed at night. The loss of a loved one, especially a spouse, is a profoundly devastating experience, and your situation is heart-wrenching. In seeking to understand potential factors that may contribute to mortality, particularly in the elderly, you've asked about foods that could increase the risk of death when consumed at night. While no food directly causes death in isolation, certain dietary choices, especially late at night, can exacerbate health conditions common in older adults, potentially leading to adverse outcomes. This article explores the relationship between nighttime eating, specific foods, and health risks in the elderly, providing a comprehensive overview grounded in scientific understanding. The elderly often face chronic conditions like heart disease, diabetes, hypertension, and gastrointestinal disorders, which can be influenced by diet. Eating late at night, particularly heavy or inappropriate foods, can strain the body's systems, disrupt sleep, and worsen underlying conditions. The circadian rhythm, which regulates bodily functions, also shifts with age, making nighttime digestion less efficient. For elderly individuals, consuming certain foods close to bedtime may increase risks like heart strain, blood sugar spikes, or aspiration, potentially contributing to serious health events. While no single food is universally lethal, the combination of specific foods, pre-existing conditions, and nighttime eating can create a perfect storm. Below, we explore categories of foods that may pose risks for the elderly when eaten at night, supported by scientific reasoning and practical advice to minimize harm. 1. High-fat and fried foods. Fried foods, such as French fries, fried chicken, or greasy snacks, and high-fat foods like butter-heavy dishes or fatty cuts of meat are difficult to digest, especially at night. The elderly often have slower gastric emptying and reduced liver and pancreatic function, which impairs fat metabolism. Consuming these foods late can lead to gastroesophageal reflux disease, GERD. High-fat meals relax the lower esophageal sphincter, allowing stomach acid to flow back into the esophagus. This can cause heartburn, discomfort, and, in severe cases, aspiration if lying down soon after eating, which is particularly dangerous for elderly individuals with weakened cough reflexes. Cardiovascular strain. Fatty foods can elevate triglyceride levels and contribute to atherosclerosis. For elderly individuals with heart disease, a heavy fatty meal at night may increase the risk of angina or heart attack, as the heart works harder to support digestion during sleep. Sleep disruption. Indigestion from fatty foods can fragment sleep, increasing stress hormones like cortisol, which may elevate blood pressure and strain the cardiovascular system. Example risk. An elderly person with coronary artery disease who eats a fried meal at 10 p.m. may experience chest pain or arrhythmia due to increased cardiac workload during digestion. Recommendation. Opt for lighter, lean proteins like baked fish or plant-based options like lentils, consumed earlier in the evening to allow ample digestion time. 2. High-sodium foods. Sodium-rich foods, such as processed meats, bacon, sausages, deli meats, canned soups, salty snacks, or fast food, can be particularly harmful for elderly individuals at night. Aging kidneys are less efficient at excreting sodium, and many elderly people have hypertension or heart failure, making sodium intake a critical concern. Blood pressure spikes. High-sodium foods cause fluid retention, increasing blood volume and pressure. At night, when the body is at rest, a sudden spike can strain the heart, potentially triggering heart failure or stroke in vulnerable individuals. Edema and breathing difficulty. Sodium-induced fluid retention can worsen edema, particularly in the lungs, leading to shortness of breath. For elderly individuals with heart or lung conditions, this can be life-threatening during sleep. Kidney stress. Late-night sodium intake burdens the kidneys, which may already be compromised in older adults, potentially exacerbating chronic kidney disease. Example risk. An elderly person with hypertension eating salty chips before bed may experience a blood pressure surge, increasing the risk of a stroke during sleep. Recommendation: choose low-sodium alternatives like fresh vegetables or unsalted nuts, and avoid processed foods, especially in the evening. 3. Sugary foods and refined carbohydrates. Sugary snacks, desserts, or refined carbohydrates like white bread, pastries, or sugary cereals can cause rapid blood sugar spikes and crashes, which are particularly dangerous for elderly individuals, especially those with diabetes or insulin resistance. Blood sugar dysregulation. Nighttime eating of sugary foods can lead to hyperglycemia, stressing the pancreas and cardiovascular system. For diabetics, poor glucose control at night increases the risk of diabetic complications, including heart attack or stroke. Metabolic strain. The body's insulin sensitivity decreases at night, making it harder to process sugars. This can lead to prolonged hyperglycemia, which damages blood vessels and organs over time. Sleep disruption. Sugar crashes can cause nighttime awakenings, increasing stress and potentially triggering arrhythmias in those with heart conditions. Example risk. An elderly diabetic eating a slice of cake at midnight may experience a blood sugar spike, leading to confusion, dehydration, or even diabetic ketoacidosis if untreated. Recommendation: if a sweet craving strikes, opt for a small portion of fruit like berries, which have natural sugars and fiber to stabilize blood sugar, consumed earlier in the evening. 4. Heavy or spicy foods. Heavy meals, such as large portions of red meat, creamy casseroles, or spicy dishes like chili or curry, can overwhelm the digestive system of elderly individuals, particularly at night. Digestive overload. Large, heavy meals require significant energy to digest, diverting blood flow to the stomach and intestines. This can strain the heart, especially in those with cardiovascular disease, and increase the risk of ischemia. Spicy food risks. Spicy foods can irritate the stomach lining, exacerbate GERD, or cause indigestion. In elderly individuals with ulcers or gastritis, this can lead to pain, bleeding, or perforation. Aspiration risk. Lying down after a heavy or spicy meal increases the risk of choking or aspiration, particularly in those with swallowing difficulties or neurological conditions like Parkinson's. Example risk. An elderly person with heart failure eating a spicy, heavy meal late at night may experience indigestion and aspiration, leading to respiratory distress. Recommendation: choose smaller, bland meals like steamed vegetables with a lean protein, eaten at least 3 hours before bedtime. 5. Caffeine and alcohol. While not foods, caffeine-containing items, coffee, tea, chocolate, and alcohol, are often consumed at night and can pose significant risks for the elderly. Caffeine. Stimulants like caffeine can increase heart rate and blood pressure, disrupt sleep, and exacerbate anxiety. In elderly individuals with arrhythmias or insomnia, caffeine at night may trigger palpitations or worsen heart conditions. Alcohol. Alcohol is a depressant that can impair breathing, especially in those with sleep apnea or lung disease. It also increases the risk of falls, dehydration, and interactions with medications, which are common in the elderly. Example risk. An elderly person with atrial fibrillation drinking coffee or wine at night may experience an irregular heartbeat, leading to a cardiac event. Recommendation: avoid caffeine after midday and limit alcohol, opting for herbal teas or water in the evening. Why timing matters. The timing of meals is critical for elderly health due to circadian rhythms and reduced physiological resilience. At night, the body prioritizes rest and repair over digestion, making late meals more likely to cause complications. Additionally, lying down soon after eating increases risks like GERD and aspiration, while sleep disruption from indigestion or blood sugar fluctuations can exacerbate chronic conditions. For elderly individuals with comorbidities, these factors compound, potentially contributing to acute events like heart attacks, strokes, or respiratory failure. Practical tips for safe nighttime eating. To minimize risks, elderly individuals should eat earlier. Aim for dinner at least 3 to 4 hours before bedtime to allow digestion. Choose light meals. Opt for easily digestible foods like soups, steamed vegetables, or lean proteins. Monitor portions. Smaller portions reduce digestive strain and lower cardiovascular risk. Stay upright. Remain upright for at least an hour after eating to prevent reflux and aspiration. Consult a doctor. For those with chronic conditions, a dietitian or physician can tailor dietary recommendations. Emotional and contextual considerations. Your experience of waking to find your spouse deceased is deeply traumatic, and seeking answers about dietary risks reflects a natural desire to understand and prevent future loss. While diet is one factor, many variables, including genetics, medical history, and unforeseen events, influence mortality. If you're processing grief or seeking closure, consider speaking with a healthcare provider or counselor to explore all aspects of your spouse's health and to support your well-being. Conclusion. Certain foods, when consumed at night, can increase health risks for elderly individuals by exacerbating chronic conditions or straining bodily systems. High-fat, high-sodium, sugary, heavy, spicy foods, caffeine, and alcohol are particularly problematic due to their effects on digestion, blood pressure, blood sugar, and sleep. By choosing lighter, nutrient-dense meals earlier in the evening and adopting safe eating habits, elderly individuals can reduce these risks. While diet is not the sole determinant of mortality, mindful eating can support better health outcomes. If you have further questions or need personalized advice, consulting a healthcare professional is recommended, and I'm here to assist with any additional information you seek. Thank you for watching and subscribe our YouTube channel.